Hi folks, it's Dr. Rob Cywes. I am the Carb Addiction Doc, and in this video we are going to review a particular patient, and I see these patients throughout practice on a regular basis, who has the blood work that is consistent with insulin suppression. I know that this has been a topic that's been very controversial, and all the carnivore evangelists come out, oh, it doesn't exist, it's not true, it's false, it's blah, 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 blah. Well, you don't know unless you know. And our practice looks for this in every one of our patients, and when we see it, we treat it. Now, let me make some very specific statements here. Number one, I truly believe and I know that a carnivore diet is the healthiest, by far, diet to improve metabolic health. No question. Number two, though, is that the correction of that metabolic correction doesn't stop when you are insulin sensitive. You reverse insulin resistance and the diseases associated with it. You don't stop when you're insulin sensitive. It doesn't just flat line. It continues to improve. And as it continues to improve, you become so fat adapted that you become insulin suppressed. And insulin is a crucial quarterback hormone that has a variety of functions. And if you do not have adequate insulin triggering, that can cause problems down the road. We've seen that with a certain population who developed non-calcified soft plaque when they were serially observed in a cardiovascular research study. But we also look at people who are not necessarily prone to cardiovascular disease, their risk of cancer, their risk of arrhythmias, their risk of Alzheimer's, their risk of autoimmune triggering, and their risk of lowering other vital hormones is significant. And it depends on your genetics, depends on how you're wired. You may not see any cardiovascular disease, but you see a fall off of these other things. And it doesn't require abandoning carnivore to correct them. What it does require is correcting insulin triggering. And you don't have to eat plants or vegetables. What triggers insulin in humans is a little bit of sugar. And we can add that very easily without going over. But let me prove to you, just with a patient's blood work, and we've got series after series of these, and you'll see these folks make comments in the comment section about what changed in their lives. And it doesn't, you can't correct. I mean, I heard one of the gum flappers on the internet, actually a very close friend of mine, say, well, I tried carbohydrates for a week and this happened. If you have type 2 diabetes, if you weigh 300 pounds and you go on a carnivore diet, everybody will tell you that you won't be healthy in a week. You won't lose 100 pounds in a week. You won't get rid of your type 2 diabetes in a week. So trying carbohydrates for 1 week and expecting to correct insulin resistance, that's false pretense. Because it takes months, if not years, to correct insulin resistance. It takes months, if not years, to correct insulin suppression. Hi folks, Carb Addiction Doc here. Ketone IQ has recently come out with a product. It's their regular Ketone IQ ketone supplement, exogenous ketone, but this one contains caffeine, okay? And I've been playing around with it. I do get a boost. I've had some people just not like the caffeine. It gets their heart racing too much. I found value to this. However, here's what intrigued me. This Ketone IQ is made from a green tea extract. And the caffeine comes from green tea. And I didn't understand that. And I went to look at some of the green teas. I drink mostly rooibos tea, but I looked at some of my green teas. And the majority of my green teas that I have in my home contain a sizable amount of caffeine. So be very cautious. Look at the green tea you're drinking, especially if you're drinking it between dinner and bedtime when I try not to drink caffeine. Make sure that there is no caffeine there. Don't be fooled and know the product, because this Ketone IQ was an aha moment for me. Now, the green tea Ketone IQ is something I use from time to time in the morning. I've been playing around with it as a surrogate for my first cup of coffee, particularly on run days for me. And I've noticed that it's a really, really cool thing to run on early in the morning. There's no way I'm going to take this in the evening. But look into the green tea. I didn't know that. I know other teas do. But check out your green tea and make sure it isn't laced with caffeine. So please do not buy into anybody that tells you can get healthy with 2 weeks on a carnivore diet, or you can get healthy, you can correct insulin resistance, insulin sensitivity, insulin suppression with 1 or 2 weeks of eating carbohydrates. The body doesn't work that way. It's slow to respond. It's resilient, but it's slow to respond. So let's look at these numbers. So firstly, this is a woman. She's in her mid-50s. Now, I've tracked her for about 8 years, okay? From when she first started the carnivore diet across to where she is now. Originally, she weighed over 250 pounds. She's 5'8". She was in her early 50s at the time. And when I first met her, she had a 0 CAC score 8 years ago, okay? So now she comes in, and 8 years later, she's gone through menopause. We repeat the CAC score. So she's gone from a 0, I think it was 48, 49, which she had the 0 done, on a carnivore diet, religious about her diet. And her CAC score now is 110, all LAD. So she has gone from having a negative CAC score to a positive CAC score. That's a fact. There it is right there, okay? I've got to be careful about that. I don't want to reveal her name. The second thing is that she has lost a dramatic amount of weight. Dramatic amount of weight. Her BMI right now is in the low 20s. She weighs 136 pounds, down from over 250, okay? BMI is 21.2. All right, so she's lost a dramatic amount of weight. Now, let's look at her blood numbers. So she is in that lean mass hyperresponder category. She has a body mass, a BMI in the 21-22 range, and a body fat percentage of around 12% for a woman in her 50s, postmenopausal woman in her 50s. Just incredible. She is a heavy exerciser. So she does a ton of exercise, mostly endurance. First of all, white cell count, 2.4. Now, I'm fine with 2.4. It's low. I'm fine with 2.4. Okay? Mostly lymphocytes and neutrophils. Her eosinophil monocyte count, which is the inflammatory metabolic counts, absolutely fine. Hemoglobin is 11.9. It's a little low, folks. That's a little low. Most commonly caused by lack of iron. Okay? Hematocrit is 32.6. Little low. Little low. Platelet count is okay, but it's in the hundreds. It's 168. I'd ideally like that a little higher. 168, absolutely fine, but it's lower than I want to see. So her bone marrow ain't working so good. White cell count is low, hemoglobin is low, platelet count is low. All three of those produced by the bone marrow. We may be dealing with a slight bone marrow issue here. Rest of the numbers look fine. Electrolytes. She takes a lot of salt, But her sodium and her chloride level, despite a lot of salt, slightly on the low side. 135/96, sodium and chloride. Other electrolytes are fine. Other electrolytes, absolutely fine. Blood sugar, 97. Now, it's a spot number, but higher than I would have expected. I would expect her to be in the 70s and 80s with blood sugar if she was insulin sensitive. 97, little high, okay? Now, most docs will, oh, not a problem, little high. BUN, blood urea nitrogen, 31. Creatinine, 1.26. Both elevated. She doesn't take creatine. She's healthy. Her kidneys are healthy. Those are protein numbers. Those are protein turnover numbers. We'll see in a second. But that's a concern for me because that BUN either reflects kidney damage that she's not peeing it out, or it means that she's turning massive. And this woman, is super skinny. BMI in the low 20s. Super skinny. So she doesn't have the protein mass to be able to turn over. Eating carnivore, eating a lot of beef, but turning that protein into energy. Why is she turning all that protein into energy? Why does she need that much? Normal BUN for this woman would be around 16. Normal creatinine would be around 0.6. Calcium level, low, 9.0. My range is 9.5 to 9.8. She takes vitamin D, but she's on the low side. Liver numbers are good. ALK phos is low, but AST and ALT are elevated. She doesn't have a fatty liver. She's got an AST of 33. Sorry, an AST of 23 and an ALT of 33. I want those below 20. Those are protein turnover numbers. Aspartate and alanine transferase, the two enzymes that turn over the amino acids and turn them into sugar in the liver. That's a concern. Gamma-glutamyl transferase, a marker of your liver inflammation, should be nice and low, 10 to 12. 23. Elevated. So there's something going on in the liver. No reason for it other than the turnover of that protein, that gluconeogenesis. And this was done early morning fasted after about 15 hours. Bilirubin is fine, 0.6. And the fractionated bilirubin is fine. Uric acid, 2.8, too low. It's a third protein waste number, but that number is too low. Iron level, 59. That's low. That's a low iron level. For someone who eats a ton of red meat, doesn't have any blood losses, she's postmenopausal, that's low. Saturation, 16%. It should be 25 to 35%. And this is in a runner. Coags are fine. PT, PDT are normal. Urine is clean. Concentrated. Specific gravity is 1030. It's concentrated. No ketones. No ketones in the urine. Interesting. The rest of the urine is clean. ANA, rheumatoid factor, are negative. She does not have autoimmune disease. She doesn't have any of the 5 autoimmune antibodies against insulin. So she does not have LADA. She doesn't have a form of type 1. Glucagon level, 132. Normal for me is around 25 to 30. 132. Okay? Very elevated glucagon. Glucagon, gluconeogenesis, glucose supply to the bloodstream, fat mobilization. Okay? We know that she's burning through protein. T3, thyroid hormone. She takes iodine. Free T3, very low. I like that to be around 2.5 to 3.3. She's at 1.8. Total T3 is low, 0.41. Testosterone level is super low. It's unmeasurably low. She doesn't have Hashimoto's. Antibodies are negative. TSH, 6.9. Elevated, that's high. Low T3. Why is she thyroid upside down on her thyroid levels? Folate, B12, overdosed on both. No issue there. Vitamin D level is perfect. 73. No issue. That's not why her calcium's low. Ferritin, independent marker of inflammation, 240. I want that below 150. Ideally, in her, I would have expected to be below 100. Now we come to the writing on the wall. CRP, 2.6. I like that. That's the highly selective CRP. I like that to be below 1. It's a marker of inflammation. Now we come to the holy grail. Remember, the blood sugar was 97 or 98, if I remember correctly. Insulin level, 2.7. That's low. And it's low in the context of an elevated blood sugar and an elevated BUN. 2.7. C-peptide. Well, we'll get to C-peptide in a second. Free T4 is slightly elevated at 2.0. Borderline. Total T4 is fine. 14. Slightly up. Okay. C-peptide. 0.8. 0.8. Low. Low with that level of sugar and that level of insulin. Estradiol levels, we measure several of them, non-existent, below the expected range, unmeasurable. Progesterone, unmeasurable. Remember, testosterone was also super low. So what do we make of these numbers? Now, let's look at the final big ones. Okay? Total cholesterol, 667. Total cholesterol, 667. Now, I like mine high. I like mine between 200 and 500. She's above that. LDL cholesterol, 330. High. Triglycerides, this is a surprise. 154. 154. HDL, 107. High HDL. I want that above 75. Why are her triglycerides so high? It's almost like she's just eaten, but she hasn't, and I trust her. Because she's turning protein into sugar. Sugar's going out. She doesn't have insulin to take it up. Sugar's coming back to the liver and being turned into fat. But her blood sugar levels are slightly elevated. That's why her A1C went up. Not her A1C, her, I'll give you the A1C in a second. That is why her CAC score went up. A1C, 5.9. Elevated. On a fastidious, pure carnivore diet for many years. Don't tell me that insulin suppression doesn't exist. Do not tell that to me. Now, this was at the beginning of the month. I started having her introduce a small amount of carbohydrate to her diet. I got an email from her 3 weeks out. My runs are better. I'm feeling better. I'm sleeping better. My exhaustion is better. This is just one person that came into my office and was seen by somebody in my office. It's not my office, but seen in this office. And has insulin suppression. But it doesn't exist. It doesn't happen. It doesn't. And by the way, this person is in the LMHR trial. So this person is one of those that has a rising soft plaque in the LMHR trial. I'm not going to change her diet in terms of the carnivore diet. She loves it. She's thankful for it. It saved her life. But we're going to correct her by introducing some simple carnivore carbohydrates to her life. And we'll slowly alter her from being about 80% fat and about 20-25% variably protein with almost no carbohydrate. We'll slowly get her into a 60-20-20. About 60% of her diet is fat, about 20% is protein, and around 20% is carbohydrate. Mostly slow carbohydrate. We'll introduce some carbs before she exercises. Slow carbs, according to the Noakes study that you'll see attached. And having done this with many other patients in the past, we will optimize her diet and optimize the way she feels. So if you're uncertain, if you're not sure, if you are a little hesitant, you love your diet, but you're not sure where you stand with it, give our practice a shot. Come and check your blood work out, and we'll review it with you. And we'll see. Not every carnivore needs to change. Yet. So, give us a shout and be realistic. I'm not going to dissuade you from the diet that you're doing. We're going to manage it and optimize it to the extent that you can so that we can keep you as healthy as you feel on a carnivore diet. I'm wearing my animal hat on purpose. I love this movie. You should definitely see it if you haven't. And it's absolutely the way to go. Absolutely the way to go. Healthiest way you can live for the planet, for yourself, for humanity. But make sure you know your numbers and you treat yourself as a human being. You're not a lion, you're not a wolf, you're not an alligator, you're not a snake, despite what other people tell you. You are human, you are an apex predator. But let's match biology to the human biology.